Over the past 18 months, health systems in Europe, Southeast Asia, and around the world have faced huge pressure from the COVID-19 pandemic. In some cases, they have simply been unable to cope. As governments in developed and developing countries have scrambled to meet the immediate challenges, it's important that we also take into account the relationship between climate change and health. Climate change represents a major challenge for public health. We're increasingly seeing the vulnerability of both our health systems and whole communities to climate-related events. A recent WHO report on short-lived climate pollutants, black carbon, ozone and methane, estimates that global measures to reduce these pollutants could result in 3.5 million lives being saved annually by 2030 and between 3 and 5 million lives annually by 2050. And this is alongside the climate benefits. There's also a clear link to global health security, the risk of zoonotic diseases crossing over, shifting disease vectors, and so on. Climate change is a key driver of health inequalities. Age, gender, social deprivation, and pre-existing conditions are key determinants of the impact of climate change on health. The most disadvantaged in our societies and globally are often the most vulnerable to poor health outcomes from climate change, and they have the most limited ability to adapt and to respond. Health systems are essential in protecting our populations from the negative impacts of climate change, including extreme weather events, flooding, food and water shortages, and reduced air quality. But health systems themselves are also vulnerable to the impacts of climate change and can be compromised when they are needed most. So, the importance of resilient health systems is clear, protecting our populations from climate-related events, driving the response to global health security threats, and delivering essential health services to our populations so they can tackle preventable deaths of mothers, newborn babies, and children, among others. As part of a green and resilient recovery, we also need to recognise the role of health systems as emitters, accounting currently for 4 to 5% of global emissions. Whilst health sector emissions are lower in low and middle income countries, these are projected to increase at rates that will make the Paris Agreement targets difficult to achieve. So it's important for all countries to develop plans for implementing low carbon as well as resilient health systems so that they are aligned with the ambition of the Paris Agreement. In recognition of these challenges, we are pleased that COP26 will have a strong health focus through the COP26 Health Programme. In May, the UK COP26 presidency, with our government and non-governmental partners, launched 2 initiatives of the COP26 Health Programme. The first is climate resilient health systems, and the second, sustainable low carbon health systems. The focus of the second, the low carbon sustainable health system initiative, is for countries to make a commitment to develop an action plan for a low carbon and sustainable health sector, which links to their national emissions reduction plans. Ideally, and where appropriate, countries should also commit to reaching net zero by a specific target date. The aim of the Climate Resilient Health System initiative is for countries to make commitments to carry out an assessment of the vulnerability and adaptive capacity of their health system to climate change, and to address their vulnerabilities in a corresponding national plan of action. Healthcare Without Harm have been a key partner in the development and delivery of the Sustainable Low Carbon Health Systems initiative. Their roadmap is a useful tool in helping countries understand how they can grow and strengthen their health systems in a way that will minimise carbon emissions as they develop, whilst also ensuring that the system can ensure to protect our populations as we increasingly suffer the impacts of climate change. In Southeast Asia, as in other parts of the world, it's important that we address both the resilience of our health systems and the emissions they are responsible for together. The roadmap provides a strong foundation for us to work from. I would like to thank Healthcare Without Harm and their partners for the work they have put into developing and disseminating the roadmap. I commend it to you as a user-friendly tool for countries to plan their health systems in such a way that health is part of the solution to the climate crisis, while still delivering good health outcomes for our populations. I want to end by urging you to take the opportunity that COP26 presents us with to drive forward real change on climate change and health by supporting these initiatives on climate resilient and sustainable health systems and on low carbon and sustainable health systems. Thank you very much.